My name is Rachel. When I was born, I got really sick, so the helicopter came to rescue me.
These medical issues caused her to be hospitalized all throughout her life, and she began to throw really intense fits. The medical side of everything was really difficult, but the behavioral was intense. Sometimes when somebody's a fighter, that means fighting for their life, and sometimes that means fighting those who are trying to help you. And that was really difficult.
My name is Wren. I'm 11 years old. This is my mom, Mickey, and this is my dad, Boots. I also have a brother named Hagen and a dog named Raven that's 2.
So she is a kiddo who was diagnosed with failure to thrive and never could gain weight, wasn't growing at the rate she should be, and continues to do that. And what we found is there's a lot of worries and anxiety around food and mealtime for her.
I remember being really scared and worried. When I started coming to Primary Children, it really helped me.
It used to be when she was quite little that in tears and not letting go of me and really scared to go to school, and I would pick her up and she'd still be crying, and now she's like, okay, this is gonna be hard, it's new, but I can do this. I'm really excited that Intermountain and Primary Children's has decided that behavioral health is something they really want to put money behind, and they want to expand services.
I am so excited that this building represents our community. In the new facility, we have 50% more inpatient beds, and we have outpatient space that's specifically designed for kids.
I was so incredibly impressed at how they did take my feedback in the whole way they designed this building. They'd have ideas that sometimes I'd get feedback and they'd change things, and it just was so impressive that they truly took into consideration what was important to a family and to a parent in this new building.
We really tried to think about the experience for our kids and families. What would it be like walking in the doors? What would it be like sitting in this room? What would it be like meeting with this clinician? It can be really scary, and a lot of times families don't know, what do I do or where do I go? So a lot of times families end up in the emergency room, and that is an option, but the 24-hour walk-in crisis center is a great option because it's really designed for kids and families who have behavioral health needs. So this is a space that's a little bit quieter. We can really focus on the child, the adolescent, the family, and really help to take our time to create the right plan for them and help connect them to those services. With the 24-hour walk-in crisis center, you do not need an appointment. Our team is ready. We're excited to have you walk in the door. You can walk in anytime. It's 24 hours.
So our team specializes in treating children and teens with a variety of mental health issues, and we work as a team using the most up-to-date, evidence-based, and best methods for helping kids with a variety of conditions. In our clinic, we're able to offer parent-child interaction therapy, or PCIT. It helps promote positive connection between the parent and the child, and also helps to reinforce positive behaviors with the child that we're likely to see more of. With the new hospital, I'm so excited that we have a facility that matches the world-class care that we provide.
One of the things that really impressed me is they built these rooms so that a parent can actually stay in the hospital with their child. Respite is so needed when your child is struggling with behavioral health issues. Another part of the hospital that I'm so excited for is the Ronald McDonald Family Room. To have that available will be so helpful for these families and for these parents.
I'm really excited for the fact that this is a safe space where kids and families can go for their behavioral health needs. It really helps to normalize that for kids and families. It's a space where you can heal, and it's a space where you can feel accepted and welcome. And I feel like families are going to come to that space. There's going to be hope that's created for them. There's going to be healing that's created. And families are going to leave feeling like they had a great experience and that they were well taken care of.
Things like the colors that we use and the images that you see throughout the building were all selected by kids. It was really important to them that the colors we used in this building were healing colors, comfortable colors. They also really enjoyed the nature themes. In the building, we have themes of water, grass and trees, and their ultimate favorite, which was space.
I think the new behavioral health will help kids and families feel welcome and safe. I am really excited for this.
Rachel has grown up into such a wonderful young woman. She has this depth about her that shows she's a survivor. She's come so far, so far. She's an incredible person.
Wren is the toughest little girl I've ever met.
She's our sweetheart.
She's been through so much in her short 11 years.
I want other kids to know that it's not just them that have worries, and there's ways to fix it, and that they're not the only ones that's having the hard times, and yeah.